Ladies and gentlemen, good afternoon. Welcome to the session devoted to scientific advice to inform policy making, balancing speed with certainty on emerging policy challenges. We have five top speakers, outstanding high-level speakers. Professor Dr. Pearl Dijkstra, who is Professor of Empirical Sociology at Erasmus University Rotterdam, and Director of Research, and she's Deputy Chair of the Group of Chief Scientific Advisors of the European Commission. Sir Paul Nurse, Director of the Francis Crick Institute, and he is Nobel Prize laureate in 2001 for his discoveries on the protein molecules controlling the division of cells in the cells cycle. Baron Peter Piot, Director of the London School of Hygiene and Tropical Medicine, and he is also special advisor to our President, to Dr. Ursula von der Leyen, President of the European Commission, on issues related to COVID-19. Professor Dr. Barbara Preinzak, Professor and Head of the Department of Political Science, University of Vienna, and she is member of the European Group of Ethics of the European Commission. And from far, but near, thanks to our connection, Dr. Kari Volinets, Acting Chief of Staff and Associate Director for Science Policy at the National Institute of Health of the United States of America. So welcome and thank you to our speakers. Our house holding rules are very simple. Our speakers will have 4 minutes to share with us their opinion and suggestions and stimuli for us. Then we can take some questions, and we have already received several questions prior to the meeting, so I could already assemble some questions for the speakers. And some questions came also from a recent SAPEA event. SAPEA is the Consortium on Science Advice for Policy by European Academies. Finally, if we have the time, there will be some possibilities still for a flash intervention from our speakers for some take-home messages for us. If questions, comments that you will make during the session will not find a reply during the session itself, what we want to do is to take this and have it for us for organizing a longer, more structured event, maybe beginning of next year, where we can go back to this issue and develop and go in depth on this. We know how science is particularly high at the center of the attention in this moment because in particular of the emergency of COVID-19, and so is the request for scientific advice to inform policy making. And the reason of the present session is exactly on this, to discuss this, in view of the expectation of certainties on novel matters where knowledge may be not mature and consolidated enough. Hence the title of the session, Balancing Speed with Certainty. And this brings us immediately to the scientific method itself. At the frontier of knowledge, sound scientific word is needed. Step by step, convergence of opinions takes place based on evidence, and apparently divergence of opinions vanish. On this, I invite our speakers to share with us their thoughts. And please, Pearl, you are the first to have the floor.
Thank you, Renzo. I'm delighted to be part of this panel. Let me start by saying that the coronavirus pandemic has led to an unprecedented mobilization of scientific research. And societies are right now witnessing the crucial role of scientific evidence as a basis for policymaking. But it will take time for scientific knowledge to be advanced to a level that will allow COVID-19 to be kept under control. In a recent statement, we addressed the question of how scientific advice can be best given to European policymakers when knowledge is fast evolving, risks are large, and evidence is preliminary and limited. The statement is the joint work of the European Commission's Group of Chief Scientific Advisors, the European Group on Ethics, and Peter Piot, Special Advisor to President Ursula von der Leyen. I want to take you through 4 key points from our statement. The first is the necessity of adopting a multidisciplinary approach. What kind of illness is COVID-19? course, that's where the biological and medical sciences come in. How can contagion be avoided? That's physics and engineering come in to determine appropriate physical distancing and the effectiveness of face masks. How can one motivate citizens to reduce human contacts? That's where the social and the behavioral sciences come in. How should complex trade-offs between economic damage, detrimental effects on mental health, inequality, and impacts be balanced? And that's where the humanities and law come in. The second key point is the necessity of communicating uncertainty. So what's known, partially known, unknown, and unknowable. It's the necessity of communicating that uncertainty to both policymakers and to the public at large. Communicating uncertainty can be difficult, but it's essential if trust in politicians and their advisors is to be maintained. It's not enough for politicians to say they are following the science. They need to understand the uncertainty in the science and its relation to the recommended measures, and to communicate that to the public well. The third key point is the necessity to be open and transparent. Being open and transparent allows the evidence upon which the advice is based to be publicly assessed, and it makes it clear whether political leaders indeed take the science seriously. Being open also allows other scientists to challenge evidence and interpretation. Relevant to this is fake news and conspiracy theories that also confound and confuse good scientific advice. And scientific advisors need to push back vigorously on such misinformation. The fourth key point is the necessity of clarity about the responsibilities in the networks from researchers to scientific advisors to political leadership. The reasoning applied by scientific advisors when bridging the gap between evidence and policy recommendations should be explained. This should include the assumptions made and normative positions taken, as well as the limitations and uncertainties encountered. Researchers and scientific advisors should also recognize that politicians sometimes have to make difficult decisions, and they may choose not to follow the policy advice. But if they do so, they should make that clear and give their reasons for not following the advice. I'll leave it at this. I hope I stuck to 4 minutes, and I look forward to the discussion. Thank you.
Thank you, Perle. Fantastic. Yeah. Ladies and gentlemen, you find this statement, of course, on the webpage of the Chief Scientific Advisors, and I recommend to read it. It's very dense and short. So, Peter, please.
Thank you so much, and really delighted to be here. And everything that Pearl said summarizes what the challenge is. Now, science without policy, without politics, without translation is fun, but it's not going to have any impact in society. And policy and politics, not informed by science or, let's say, going against science, can be really disastrous and can even cost lives. And I will give some examples of that. Now, today's crisis is, science has been more at the forefront than ever before and in the public eye. And the main challenge, as Pearl just said, is about managing uncertainty. It's uncertainty on all sides. And that adds to the complexity of the normal, complex relationship between science and policy. And I've been on so-called both sides of the fence. When I was head of UNAIDS, I was so-called policymaker, working directly with Kofi Annan, and we had to decide and recommend policies. But I've also, and I'm still a scientist. And I've learned it the hard way, what the tensions that are there and the differences of culture. And let me mention just three. One is that, scientists advise and politicians or policymakers decide. Not all scientists understand that, and some politicians try to play the scientist or explain very complex scientific things. Two, the notion of time is completely different in science and in policy. There's, you need a policy advice in 2 hours and that's it. And our deadlines are grants and so deadlines, but articles always or very often end with more research is needed. Forget about that. Thirdly, policy is most of the time about trade-offs. It's not like 100% is going black and 0% white or the other way around. And that in science we don't always like. We don't like these compromises. So this is all illustrates what Pearl said. And this is particularly now in the times of crisis where scientists are so in the limelight, in the spotlight. But some scientists, are struggling with the dilemma, in the terms that it's very deep-rooted in our culture and our personality to argue, to challenge, and to have public or private disputes. When you do that in public, that's a challenge in times of uncertainty because it can undermine the trust in science and the trust by policymakers. On the other hand, we can't also hide from the debates. So that is a real dilemma. Now, where there is synergy between the science and the politics, I think is really powerful. Where there is antagonism or incompatibility, lives are lost. And let me give a few examples from my AIDS experience. On the last point, where lives are lost, is when we were confronted with a president of South Africa, Thabo Mbeki, who didn't believe that AIDS existed, didn't believe that treatment was possible, and he was lining up with some alternative scientists as he saw it. And according to studies from Harvard University, that caused about 350,000 deaths because he refused to introduce antiretroviral therapy. That's the first extreme example. Secondly, where the evidence is counterintuitive to what people think. And in HIV, that's an example, is needle exchange. Giving needles to drug addicts who shoot themselves, we know from strong evidence that prevents them from becoming infected with HIV. But that's very hard for a politician to accept, for the people to accept. And yet, that's what the evidence said. Very difficult. And some countries have gone through it, and others never made it, including in Europe. Third example is then when science goes to, let's say, culture, religion, and all that. Very simple example, condoms, and you can say that really then will generate suddenly promiscuous sexual behavior. Or vaccination against papillomavirus in girls. Very big opposition from some people because they think that the girls will become promiscuous. So there are lots of issues where we have to study and to learn from that. Now, COVID-19, and this is my end now, let's not forget that none of us had ever been confronted with a problem this size, be it a politician, be it scientists. And so we need to learn, and learn very fast. It's really learning while we're sailing, or maybe better while we're racing. And so we make mistakes. And then we have to learn immediately from this mistake. So the reviews and the learning should not come when it's all over, but while we're doing it. And that is really a big, I think, place also for the social sciences. Because as Pearl said in the document, it can only be tackled through multidisciplinary work. So some humility on all sides, I think, would be good. Humility in terms of what science knows, what politicians can do, that the North knows best, that the richer countries know best. We have, the countries with the strongest science and research traditions, like the US and the UK, have not done particularly well tackling this epidemic, whereas some developing countries like Vietnam or Senegal and so on, they've done a good job. So we have to look at it, how we learn from this kind of experiences. And finally, I would say nothing can replace trust and public trust. And how to gain that is one of the biggest challenges also for scientists. At the moment, we're very high in the hit parade of trust, but that can change overnight. And the next challenge will be introduction of vaccines, and the slightest problem that will occur can reverse that trust also. We already have the fake news, the anti-vaxxers and so on. And it's not enough to give more information. we need to listen to people, what their concerns are, and then manage that also and reflect on it. So exciting field to be in at the moment.
Thank you. Thank you for your scientific arguments that are also emotionally touchy. Paul, please. No, we don't hear. Moment. Yeah, go. Please go on. Yeah. Sorry, there is a problem with you. Barbara, bitte sehr. Sie sind doch dran. Barbara?
Yeah, I'm here. Yes.
Okay.
Can you hear me?
Yes, please.
Good. So we already heard about one important value, and that value is humility. I want to talk about values at this interface of policymaking and science. And I would want to pick one value that both in the joint statement that Pearl introduced and also in the EGE statement about the COVID crisis featured very prominently, and that was solidarity. So I pick solidarity because it's a value that we heard a lot about, especially in the earlier phases of the crisis, in the sense that there were calls for a need for solidarity. Policymakers even spoke of an obligation to solidarity. And I think that is a double-edged sword, because as nice as solidarity is, I think the inflationary use of that value can be very problematic. And I think a lot of people have the experience that they feel that solidarity is not on the rise. And I think in the context of a pandemic, where the costs are so unevenly distributed, this is maybe not surprising. So the people who are already economically and socially disadvantaged do not only have a higher risk to suffer from COVID, to die of COVID, but they also bear the greatest share of the economic costs. So I think it's very, very important to keep in mind that poverty is actually not only an economic but also a biological risk, because people with lower socioeconomic status also have lower health status and so on. So they have a higher biological risk. So this is where solidarity comes in. Person-to-person solidarity might be fluid. It might be fluctuating in the sense that in the earlier stages of the crisis, many of us experienced neighbors helping them, younger people helping older people. So we experienced a lot of person-to-person solidarity. But as the crisis continues, as it becomes more painful, especially for the vulnerable and the marginalized, something happens that scientists call in and out group polarization. So we see more and more fragmentation between the different groups. But solidarity takes place at different levels. It also has an institutional level, an institutional manifestation. And here, the COVID crisis has shown us very, very clearly that the countries that do relatively well during the crisis are not necessarily those with the most obedient people or the most fancy digital technologies, but they are those with solidaristic institutions and with strong public services and infrastructures. And this is what we can learn in policymaking from the notion of solidarity. At the moment, we see in policymaking a strong emphasis on short-term measures, and maybe rightly so. Politicians focus on addressing the most acute and the most painful harms emerging from the crisis. But we are also running the risk of the COVIDization of poverty. What do I mean by that? I mean that we are getting into a narrative where we think that those who lost their jobs, those who became poor during Corona are the problem, and those who already were poor before that, that's not so bad. Poverty is always a problem. The one thing to increase our pandemic preparedness, to make us better prepared to deal with this one and the next one, is to create measures to sustainably address the root causes of pandemics. And one of the root causes is poverty. So this is what we can learn from solidarity. Specifically, I will end with 3 points. Policymakers, this is what we can learn from science with and on values. Policymakers should first of all acknowledge the pain that people are feeling and not ignore it for the fear of being unpopular. They should also acknowledge uncertainty. They should acknowledge that we are on uncharted territory. We have, as Pearl already said, high levels of uncertainty and speedy decisions need to be made. That's not easy for anyone. So the solution must be, and that will also enhance solidarity and it will improve things for everyone, to reduce uncertainty. What do I mean by that? I do not mean to say that the crisis will end in November or in May, or there will be a vaccine in October. Those kinds of statements are very, very problematic, and they help to decrease trust in science and policymaking. But we can reduce uncertainty by reducing the social and economic factors that make people uncertain, to help people know that they will have money tomorrow, they will be able to pay the rent tomorrow, and they will also have a planet that is still standing. Standing is not the right word, but a planet that is not destroyed in the next decade. So these kinds of social, economic, and environmental uncertainties should be reduced. If we do this, then we will be better prepared to deal with this pandemic and definitely better prepared to deal with the next.
Danke Ihnen. Thank you, Barbara. Paul, it seems that the connection is now working. I hope it is the case. It's not working. Then it is not the case. Then, Carrie, I left you as the last one just to give you a bit the time and the possibility to get acquainted with the speakers. But please, now it's your turn. You have the floor.
Thank you, and thank you very much for the opportunity to participate today. I'm really honored to be here. I want to pick up on a point that I think Pearl and Peter both made, which is this intersection of both uncertainty and time in the face of an evolving situation. I think one of the biggest challenges we always have at the intersection of science and policy are when things are moving in real world situations. So when they are evolutionary and emerging, most often we see this in the case of emerging biotechnology, but I think we're seeing this play out in the COVID crisis as well, in the sense that while scientists are very comfortable with the concept that today's hypothesis is only as good as tomorrow's discovery, I think that's very difficult from a both communications in terms of public and policymakers and real-world policy point of view, because it requires dynamism to be able to adjust as new information comes forward, as we collect more data, as the knowledge really develops in real time. Policy as sort of a whole isn't great at turning on a dime and moving with that kind of dynamism. And so this has been a continuing and ongoing challenge, not only explaining uncertainty, but also explaining how the landscape of uncertainty changes over time, and holding ourselves and accountable for explaining that in a very real and understandable way. And I think that brings me to another point. I'm conscious of the fact that I'm joining you from the United States and speaking to an audience hosted by the European Commission. And so I think it's a good point to make a note of the importance of international cooperation in this intersection of science and policy, particularly since we have a really, truly global scientific community. And this is one of those rare cases in which the entire world is in this together, although a lot of metrics and news and conversations are happening at a nation by nation level or perhaps continent by continent level. The science is truly a global undertaking. And so, as an entire scientific community, it's an opportunity to work together to pool our best and brightest minds and resources to really think through how do we collectively deal with this challenge of being transparent and explaining uncertainty and changes in knowledge over time in a way that helps not only our own sort of regional, local, and national policymakers, but really the policymaking community of the world in a way that is helpful in addressing the current challenges. So let me stop there and look forward to the discussion.
Thank you, Carrie, for this and for this highlighting the power of international cooperation, and thank you for being with us. Paul, are you now with us with video and audio?
Can you hear me?
Splendid.
Very good. Okay, so first of all, it's a pleasure to be speaking with you. And I missed some of the remarks, but the first two from Pearl and Peter I heard. And I will be repeating some of the same things that they had said, but perhaps looking a little more at science advice more generally beyond COVID. The first point I want to make is that embedding science and high quality debate about science into policy is absolutely crucial. It's crucial now, and it will be increasingly more so in the future. The reason for this is, of course, that our modern society is built on science. It's built on the advances of science and technology. Indeed, nearly everything we do is touched by science, or the technology is based on science. And of course, what we've just witnessed with my inability to communicate, that things can sometimes go wrong with that technology. Anyway, let's hope I continue to be heard. We face great challenges, and these challenges require science, nearly all of them, and the use of science. The Green Deal, for example, protecting the environment, dealing with climate change, food sustainability, improvement in health, driving a knowledge economy. We need science both to understand these issues and also to provide solutions to these issues. And that's why science needs to be embedded into policy making. Now, policy making and policymakers and scientists need to work together. This has already been emphasized, and they need to work with the public to ensure that society is at ease with science. And that needs excellent communications between policymakers, scientists, and the public. Now, how do we bring this about? What are the problems in bringing it about? First, as already has been emphasized, is the clarity that politicians make policy and they take account of advice that comes from scientists, but it's politicians that have the responsibility for making policy. We need to have a range of scientists involved, the multidisciplinary point that Pearl made, but I want to add something more. We need different scientists to work well together. When we come from different disciplines, we have different cultures, different ways of working, and we have to learn how to work together. We don't always speak the same language, and this needs practice beforehand so that when a crisis occurs, such as this pandemic, that different scientists know how to communicate one with another, and also, of course, with social scientists and with the humanities as well, as Pearl emphasized. The tentative nature of science and uncertainty is crucial. And the reason this is perhaps not well understood is because at school and thereafter, we're often taught that science is absolute knowledge, something that is chiseled in granite. And it's difficult, I think, for policymakers to understand that that isn't always the case. Science often begins as a tentative idea, a hypothesis. It then needs to be tested, and if the testing works, then a hypothesis can be accepted. Newton's laws of motion, for example, would be a case in point. But if science is thought to be absolute, an absolute truth, uncertainty and changing in opinion is difficult to deal with. Now, politicians can be tempted to simplify, and they like too often tabloid one-liners, and this needs to be replaced by more thoughtful communications, a recognition that the science may change and the policies therefore might change. And for that to work, the public have to have total confidence and trust in this process. And to achieve that, again, as has been emphasized, we need an emphasis on openness and transparency, good explanation of the evidence, including the quality of that evidence, as well as humility, as Peter mentioned. We need humility, combined with much more sophisticated communication than is normally the case in the political arena. The openness means that different scientific opinions will be expressed by different scientists. That's difficult to deal with, but it is essential. We should not hide those differences. Now, some of those opinions are nonsense, 5G and COVID. These should be dealt with and eliminated robustly. But others are legitimate. They need discussion. And policymakers need to say which scientific arguments they are using for their policy, and they need to be prepared to change policy and to explain why. Otherwise, they will lose the trust and confidence of the public. Good policymakers respect evidence, respect logical argument, and respect the scientific advice. Unfortunately, bad policymakers do not. And a good scientific approach like this does not always sit comfortably with populist politicians. They tend to rely on the one-liners I've mentioned without much beneath them. On emotional appeals, they tend not to have humility. This is not good for a responsible science advice system. So my take-home message, for society to thrive, science must be embedded in policymaking. And the politicians need to work with scientists, and populist approaches based on emotion, opinion, oversimplification will only lead to bad policy. Thank you very much.
Thank you, Paul. Thank you for this. I would like to go to the questions that we have received prior to the session. And Paul, you say something that our society is built on science and science and technology. And one question is exactly on these, that a few months ago, the feeling was that there was a decline in trust from many parts of the population on evidence and on science. Even science was considered by some positions that was possible to read as an elitist approach, as a technologist approach, not understood by many people. I would like to propose Barbara to comment on this. Do you think, Barbara, that the COVID experience, where immediately there has been a request to science to tell, to solve the problems, is this experience changing this perceived lack of trust of, let's say, 1 year ago? If there has been a lack of trust, by the way.
So, Renzo, let me say that first of all, we do not have good data on that yet. So what I say is based on previous experiences and previous research that we have analyzed. So first of all, I think that the so-called declining trust in science is, as you said, also an articulation of distrust in what are seen as elites and authorities. And one could say that this is irrational, but one could also say that maybe this is an expression of a more widespread feeling that politicians and other elites and also scientists have not really worked for the benefit of the people for a long time. So I see this as quite an alarming statement of people to say that inequalities are increasing, the environment is declining, the earth is warming. So science and policy hasn't done such a great job. I think it's an articulation of that. And if this is true, if my interpretation is true, and this is not only mine, but other people see it similarly, then the corona crisis is, it remains to be seen. So far, I don't think we have grounds to believe that the COVID crisis has really helped to increase trust in science and policymaking. I wish it were otherwise, but I think especially also in the role of some media that portray every issue as a debate between pros and cons. So mouth and nose protection, there's pro and con, and vaccination, there's pro and con. So that doesn't help either. It's not only then the distrust in elites that have disappointed people in other ways than in science, but also it is this idea that we have to have two sides of everything. There's not always two sides of everything. Sometimes that there's a wide scientific consensus, and then there's some people who have particular interests who stand outside, and then they are portrayed as having equal scientific standing. There's a call to action here for responsible media and science communication as well.
Thank you for this. This is all hints for further thinking and in-depth analysis. And all this goes to the management of complexity, because we are talking about complex and complicated. There are two different concepts, as we know. And one question was on this, and I would like to address Carrie, if you want to comment on this, about the network science. The network science, the science of complex systems. In Europe, we are very knowledgeable about the work on the thermodynamics on non-steady states. That is something different. But can these help conceptualizing and modeling, the modeling efforts? Could you comment on this in order to support the scientific advice?
Yes, absolutely. I mean, certainly complex problems merit complex solutions. And I think you've heard nearly everybody on this panel talk about the value of an interdisciplinary approach to address the current crisis. And I wholeheartedly support and agree with that. I think this is a real opportunity to think about how we use that complicated information in a very real and practical way. The challenge, of course, is that the modeling is only going to be as good as the data going in. So it really does present an opportunity to again, harken back to international cooperation and data quality, but also a communication strategy that allows you to explain the complexity of the model, again, that element of uncertainty, what assumptions are we making, and then ultimately why we see a modeling exercise change over time. I think, a great example of this that you're watching play out again in the real world is this concept of metrics, whether it's case metrics, transmission rates, deaths. I think one of the things that the public has been really struggling with is understanding how models change over time depending on policies put into place and human behavior. So why is it that, one day we're predicting this number of deaths and the next day those same models are predicting a different number of deaths because different public health measures or behaviors have taken place over time. So it is that pairing of both using those network solutions with having a strategy to be able to explain them in a transparent and understandable way.
Thank you, Carrie. This is really not an end point, but it's a starting point for going in depth on this. We have twice very similar questions. One to Paul, just arrived now, and one to Pearl, arrived before this meeting. What would you do differently, Paul? This was this question to you. And to Pearl is, in the case of the next crisis, be a pandemic, be another crisis, which lessons you have learned now, and how can you do better in delivering science advice to policy? Maybe very short, Paul, and then Pearl. Paul, first you.
I have a quick answer. I would focus on excellent communication. I'm not sure that we know how to communicate these complexities, to communicate uncertainties, and I'm sure the politicians and the scientists have made mistakes here. So I would focus on the communication. I think too much we've been using tabloid-type headlines to communicate in this arena, and we have to be much more sophisticated about it. Focus on communication.
Thank you. Pearl, how would you advise politics for the next crisis? If there will be a next crisis, but might be.
Well, I'm a bit hesitant because I think that we're going to have COVID is going to be with us for quite some time. So that would be one part of my answer. Another is yes, undoubtedly there'll be another pandemic. And what I would point to, I would advise policymakers, and I will be reiterating part of what Barbara has been saying, that it's crucial to look at underlying fundamental causes. And it has to do with the way we live. It has to do with the way we've organized our economy, the travel, the encroachment upon wildlife. It sounds very much Green Dealish, but I think that by realizing the ideals of the Green Deal, that's one way to help prevent possibly coming pandemics, but also to deal with them and then to deal better with the inequalities that we've all been talking about.
Thank you for this. Peter, there was a question, maybe it's something also for you, is again about the best practices. Now, what to do better? You were tackling a bit the best practices. Is there something else you want to comment, or whatever you want to say for us as a take-home message, because we are close to the end of the session?
I think it's really premature to say what is best practice or not. I think we probably have all a long list of bad practices. But what is the real best practices? I totally agree with what Pearl said. We're only at the beginning, and of this, this pandemic, and we are in here for the long haul. And what the ultimate result will be of the various dialogues between science and policy, we have to see. I think what's key is that there is a pre-existing relationship between those in power and the policymakers and scientists, so that you don't meet each other for the first time when there's a crisis. It's always best for any relationship that you meet also, when the sun shines and when there are no problems, and you can get to know each other well. Third point I would say is that I agree with Paul, communication. And it's having strong scientists and strong research is not a guarantee that will influence or be translated or adopted by politicians. Absolutely not. So we as scientists, we must also look at ourselves and see how can we improve the communications. And finally, I would say we tend to forget that this is about people. About people, I mean, for example, the issues that Barbara put on the table, I mean, crisis and epidemics, they expose the fault lines in society. And if we don't speak, our scientific language that can affect people's hearts and minds, I think that's not going to work. And that's, when I saw in the UK, it was all about flattening the curve. You had a prime minister giving a lecture on reproductive rates. I mean, it's close to being ridiculous, frankly, that it's not even very useful. And things like that. So that's one of the reasons that I decided to come out when I had COVID myself. I said I want to have a personal story that can then at the same time explain the science. I mean, I don't wish that, I don't say that that's the model or best practice to say, but I thought, okay, now that I've got it, let's make use of that opportunity and, go both to publish into science, but also in social media and so on. And so I try I think that link we must make with people's lives. Otherwise, the trust, again, will not be there. They say, okay, that's not my problem.
Thank you so much. The time is terrifically short, so great clarity. Thank you to the panelists. Thank you to those who asked questions. And before and during the session, importance of delivery policymaker with sound evidence-based scientific advice and communicating it. So we probably have to improve this. Vividly, the need of research and innovation and training, importance that. important multi and supradisciplinary research, so not only within the natural science, but also with social science and humanities, at the intersection science policy in particular. Thank you, and hope to see you to a next event beginning next year. Thank you so much to you all.